No
Okay.
labs this time around, November
Okay.
9th. So, okay?
You're always one paycheck from being homeless.
You're coming back on the 9th for a follow-up just to see how your blood pressure is doing.
So one day I went to work and they told me that my job was no longer needed for me. 14 years working. I was a dedicated worker. And then a few years ago, a tree fell on my home. And by me not having a job and my husband died, my home insurance lapsed. So I couldn't get my home fixed and that hurt. So I was homeless.
And what are we going to do every day?
I'm gonna take my medicine. I had high blood pressure and I didn't have any insurance. And I went to the health department and they told me about this clinic. I didn't know there was help out here for people that didn't have insurance or didn't know which way to turn.
The purpose of the clinic is to provide health care to those that have no insurance, are underinsured.
The clinic is located now at 8th Street in downtown Augusta. It's a student-run health clinic that provides general medical care.
And we meet every Monday night and we run until we see the last patient. We get to learn, but the patients get to see a doctor, and they get to see that doctor even though they don't have insurance or they're maybe not able to pay for something. They're able to come here and get the medications and the things that they need and seek the treatment that they need.
We provide 100% free care, including labs, the physician follow-up, ultrasounds, prenatal care.
This clinic is so nice and it do more than just pass out prescriptions or diagnosis. They're here and they listen and they care.
When you walk in those doors, no matter what, you're a patient, and you're a patient first. There's no judging.
I come here and it's like I'm being made whole again.
I see those patients when they leave. I see they're broken and hurt. And if I can try to help and heal them or nurture them or get them back to a healthy place with the aid of the students and the physicians here, then that makes it all better.
I was down real low, and to have a place like this clinic, can't beat it for nothing.
Thank you, Ms. Lindsay.
Thank you.
It's rewarding and it's frustrating. It's, sort of both. It's rewarding in the sense that there are, patients that are incredibly thankful for just the slightest things that you do for them. It's frustrating in the sense that there are gaps in our healthcare system. We talk about it being the best healthcare system in the world, and it is if you can get to it. Unfortunately, there are a lot of people that can't get to it.
Everybody should be able to receive health care. That was a reason I wanted to help with this clinic. That's why I wanted to be here.
The mission here is to provide the best health care you can at the lowest cost. And if I can give it to them free, then by all means those doors will stay open so that we can continue to provide the service we do.